Tuesday, January 9th, and this is Reporting Live with Dr. Desai. There has been so much talk about pneumonia these days with all of the respiratory bugs in the community. We've also had some big names out there. Mary Lou Retton had a very severe pneumonia, now home. She just had an interview on one of the major networks about her recovery. So let's really talk about pneumonia and what it is, because sometimes I think that word and diagnosis is used a little sparingly. So what is pneumonia? Well, think about it. It's infection, inflammation of the lungs. As air breathes in through our nose, it goes down through our trachea into our bronchi, deeper into our lungs. We have very tiny little sacs called alveoli. When we do that, sometimes what happens is breathing in, we breathe in bugs, we breathe in bacteria, we breathe in viruses. There's no way to 100% prevent that. It is the job of our immune system to, once we breathe in, inside the lung, the immune system that is built in, to attack those and eliminate those from our body through different immunologic mechanisms. That's what happens normally. But we all know we can get sick. When we get sick from a virus, a common cold, we can become a little immunocompromised. Our immune system may not be as strong. Sometimes the load of what we're breathing in may be too big for our system to fight off. So as that bacteria or virus gets trapped into those alveoli, they start developing some inflammation and fluid starts leaking out. That fluid can't get cleared. Over time, that inflammation gets worse and a pneumonia develops in a different part of the lungs. That's what happens. They can be mild to moderate to really severe. When we think about what causes a pneumonia in terms of the bugs, there's bacteria, there's viruses, and there's fungi. We really want to focus more on the bacterial and viral elements. Remember, viruses do not need antibiotics. Viruses like the flu and COVID have certain antiviral medications that can work if taken right and at the right time appropriately. For a bacterial pneumonia, antibiotics are still your best. What are your signs of a pneumonia? Coughing, a lot of sputum or mucus production spitting up with that cough, and sometimes really gross. Yellow, green, blood-tinged sputum is definitely a warning sign. Fevers, shortness of breath. Also starting to breathe faster because you just can't catch your breath. Those are signs to look for. When should you see a doctor? If you think you have a pneumonia, you should seek medical attention. That does not mean you're going to get admitted, but that means you need to be evaluated and determine, is this bacterial or is this viral? Those above 65 years old, those with compromised immune systems, and our children less than 5 are most susceptible to these, and we want to take care. What can you do to prevent a pneumonia? Well, for certain population, including those above 65, there is the pneumococcal vaccine, which protects against strep pneumonia and some of the big ones. The other thing is flu, COVID vaccines. Those are important. Also the RSV vaccine for the right population. And for our pediatric population, making sure they get their vaccines, which includes a pneumococcal vaccine, on time in their series. Other things you can do to prevent. If you're a smoker, stop smoking. Damaging your lungs impedes and blocks the ability for those lungs to really block out those viruses, those bacteria that breathe in, and really creates more of a disturbance and inflammatory process easier. And then, of course, the common things being common. Good hand washing. You touch your eyes, you touch your mouth with dirty hands. Guess what? You're going to definitely possibly get some bacteria viruses into your lungs somehow, and it has to fight it off. Also, masking when appropriate. If you're sick, always a good opportunity. And distancing when you're sick. We know that if you're sick, isolate yourself because your pneumonia may be mild, but your next door neighbor, your mother, your father, somebody else's could be more severe. That's what it's all about pneumonia. It's a word that we need to know. It's a diagnosis we need to know. This is Reporting Live with Dr. Desai.